The macula is the central part of the retina. It's the bit that's used for detail vision, such as reading, watching the TV, and recognizing people's faces. With AMD, these things become increasingly difficult because the macula gradually degenerates. This is because of a wear and tear change related to your age. This slow aging change is known as dry macular degeneration. Sometimes a complication occurs where abnormal blood vessels grow in the worn out area. These blood vessels produce fluid which lifts up the retina. This makes the central vision become much worse and much more rapidly. This is known as wet AMD. It often causes the vision to become distorted. We can all develop AMD as we become older. However, there is a genetic tendency. In some families, one does see a fairly strong genetic tendency, with many family members being affected. Several genes have been identified which seem to affect the development of AMD. It is possible to be tested for some of these genes, although such testing is not generally offered to the public. AMD is a common condition, and so you can't assume that it's genetic just because several people in one family have been affected. Yes, macular degeneration can cause blindness, and in fact it is the leading cause of blind registration in people over the age of 65 in the Western world. It rarely causes loss of all of the vision, but it often makes the central vision very poor. There's no proven and accessible treatment for the common dry form of AMD. The wet form can be treated using certain drugs which are proven very effective. Often many of these treatments are required. None of them is a complete cure, and even when the wet AMD is stable, the dry part of the condition tends to become slowly worse over time. We know that smoking definitely makes AMD worse, and people with this condition should not smoke. There is good evidence that a high intake of certain antioxidant vitamins can help protect against AMD. If you eat a good diet with plenty of leafy green vegetables, then you probably consume all of the necessary antioxidants. If you're not sure about your diet, then you can take a multivitamin tablet containing the appropriate vitamins and other substances. This condition usually causes a slow reduction in the central vision, with difficulty reading and other tasks requiring detailed vision. Often the eyes become slower to adapt to changes in light intensity. The most important symptom for wet AMD is that of distortion of the central vision, where straight lines no longer look straight but instead appear curved or kinked. If either eye develops that symptom, you should have your eyes checked very promptly.